The spread of infectious diseases is influenced by ecological, environmental, and/or demographic factors. Ecological factors such as agriculture, changes in water ecosystems, deforestations, floods and drought, or climate change affect the emergence of infectious diseases, including cholera, hantavirus pulmonary syndrome, and dengue fever. Cholera is an acute intestinal disease caused by Vibrio cholerae bacterium. The disease is initiated when water is contaminated by this bacterium and ingested by humans. One of the areas with most severe outbreaks of cholera is Bangladesh. The outbreaks there have been linked to weather because infection rates are higher in seasons of extreme flooding. People are using water that has been contaminated for drinking, bathing, or washing because there is a shortage of clean water. It has also been shown that fluctuations of the disease are also related to the interannual climate oscillation, particularly from weather extremes caused by El Niño. El Niño is responsible for warming of water temperature in the eastern Pacific Ocean, which has an effect on the increase of the outbreaks in Bangladesh. This phenomenon has been observed and analyzed for a 70-year period and suggests that global warming over the last century has affected human disease. Another disease which has been affected by the weather extremes caused by El Niño is hantavirus pulmonary syndrome, or HPS, which is transmitted by rodents and in the southwest United States. HPS has been linked to the sin nombre virus. In the summer of 1993, there was an outbreak of HPS in the Four Corners area of Arizona, New Mexico, Colorado, and Utah, which has been attributed to an above-average amount of precipitation the previous winter due to an El Niño event. The increased precipitation had created a surplus food source for rodents, which led to a larger rodent population, thus upping the possibility of infection through aspiration of rodent feces and urine. In other parts of the world, according to the World Health Organization, dengue fever is the world's fastest-growing vector-borne disease next to malaria. There were more than 890,000 cases of dengue reported in 2007, and it is estimated that more than 50 million infections will occur worldwide every year, and that more than 2/5 of the world's population is at risk from dengue. Additionally, it is projected that climate change will directly affect the spread of vector-borne diseases. However, the only way to prevent dengue virus transmission is to combat the disease-carrying mosquitoes. Not only will climate change place additional stress on ecosystems, the transmission of the disease will increase, bringing suffering to individuals who live in poor conditions or areas where medicine is not readily available. Disease vectors such as mosquitoes thrive in wet, warm, and humid environments. More rainfall and temperature changes, especially warming at night, will provide optimal conditions for the mosquito to breed and expand into new territories. Overall, there are many infectious diseases, far more than mentioned here, that have been affected by climate change around the world. It is likely that unless this issue is resolved, that even more infections will be more easily transmitted and increased in intensity. Scientists have made the correlations between climate change and infectious diseases, and it is time that the world takes notice to prevent widespread pandemics.